About 20 years ago, when I lived in Chicago, I became sad in the winter. And I didn't really understand why, even though I was practicing medicine and I'd heard of seasonal affective disorder, but I didn't get into understanding it until it affected me personally. And so I wanted to make this video to tell you a little bit about how seasonal affective disorder is diagnosed, how you can know whether you have it, and what to do about it, what are the most successful treatments. Seasonal affective disorder is basically slow running of your biological clock. It's a circadian problem, really. The trigger for it is shorter days in winter, and it lasts about 5 months for most people, from November through March. And it affects people who live above a line drawn between Los Angeles and Atlanta, roughly. 5% of all depression is seasonal affective disorder, and the really good part about this is that it's much more amenable to treatment than ordinary depression. It is, in fact, a kind of ordinary depression. The symptoms are very much the same. You have overwhelming fatigue. You have extra carbohydrate craving, and it can, in fact, have suicidal tendencies just like ordinary depression does, because, again, it's kind of a subset of ordinary depression. Seasonal affective disorder may also be evidence of a nature deficit, that is, not having enough sunlight. And to know whether you have a nature deficit, you can go to naturedeficitquiz.com and take the free quiz and get some resources for getting outside more even in winter, which, by the way, is beneficial. There is an FDA-approved medication for seasonal affective disorder. Wellbutrin is the trade name, and it does have some effectiveness. But as I mentioned, bright light therapy is the first therapy to try, and it works in at least half of people in about 4 weeks. And the way to apply bright light therapy is to get a light that's 10,000 lux with a filter, a UV filter, so the UVB rays don't hurt your skin or hurt your eyes, because it's going to impact the back of your retina for 30 minutes within just 2 feet of you, so that your melatonin and pineal gland pumping out your melatonin is reset. Melatonin is the hormone that rises at night and makes you feel sleepy, and it tapers off in the morning. What you're doing with bright light therapy is giving yourself a kind of artificial dawn. You're creating your own dawn, which is more like that in summer, so that the wavelength of the lights from the 10,000 lux lights are more like you get from the sun in summer. And so your brain resets, thinking that it is, in fact, summer, and kicking you out of this depressive state. Seasonal affective disorder often interferes with sleep, and so you can do things to sleep better, and we call this sleep hygiene. How do you do that? Well, you sleep only as much as you actually need to feel rested, and then you get out of bed. You try to keep a regular sleep schedule. You don't try to sleep unless you feel sleepy. You get up after 15 minutes if you're not sleepy in bed, and you do something else. You exercise regularly. Exercise is a great treatment for insomnia. Aerobic exercise during the day helps you sleep better at night. Don't drink caffeinated beverages at night, whether they're energy drinks or Coca-Cola or coffee or even tea. At night, meaning, within 4 hours of going to bed. All these things actually interfere with sleep, and the more that you can change them and optimize them, the better your sleep hygiene and the better your sleep will be. 2 other ways to fight seasonal affective disorder: working out and getting natural light. You can actually combine these by working out outside. If you can't work out outside, then try to do exercise inside with natural light. Do yoga near a window, for example, or have a window view of outside when you're working out inside. So try these things as a way to combat seasonal affective disorder, and let me know in the comments if they work. If you're not sure if you have seasonal affective disorder, take the sadquiz.com. It's free. We're really interested in helping people identify this, and I really want you to feel better. And you can do that by knowing whether you have it to begin with. So take the quiz, check it out, and feel better soon.